Hi again, and welcome back to Introduction to Radiology Medical Coding. This is video, and we're going to cover the three major coding systems every radiology coder needs to know: CPT, HCPCS Level II, and ICD10CM. These systems form the core of accurate billable documentation in healthcare, and by the end of this module, you'll feel confident using them in your own coding work. Let's get started. Section 1. Meet the three code sets. In the U.S., we rely on three main code sets for healthcare billing: CPT for procedures and services, HCPCS Level II for supplies and services not covered by CPT, ICD10 for diagnoses. These codes turn complex medical information into standardized formats, making it easier to submit claims and get reimbursed. If you're coding in radiology, mastering these is a must. Section 2. CPT, current procedural terminology. Let's start with CPT, created and maintained by the American Medical Association. CPT is the foundation for coding medical procedures and services. It's also known as HCPCS Level I and is used across all payers: Medicare, Medicaid, and private insurers. CPT codes are divided into three categories. Category 1. These are the most commonly used. Each code is 5 digits long and used for reporting procedures and professional services. There are over 7,000 codes in this section, organized by specialty. In the radiology section, you'll find these subsections: diagnostic imaging, ultrasound, radiologic guidance, mammography, bone and joint studies, radiation oncology, nuclear medicine. Category 2. These are optional codes for tracking performance and quality of care. They usually end in the letter F. You might use these alongside other codes, but they're not required for billing. Category 3. These are temporary codes for new and emerging services or technologies. If a Category 3 code is available, you should use it instead of an unlisted Category 1 code. These codes end in the letter T and are used to gather data and help shape healthcare policy. Section 3. HCS Level II, Supplies and Services. HCPCS Level II was developed by CMS to cover things that CPT does not, like medical equipment, ambulance rides, medications, prosthetics. These codes start with a letter followed by 4 numbers. For example, A codes for ambulance and medical supplies, E codes for equipment, J codes for drugs, R codes for diagnostic radiology. You'll find HCPCS Level II codes especially helpful when billing for things like contrast media, radiopharmaceuticals, or supplies used during imaging procedures. Section 4. ICD10CM Diagnoses. ICD10CM stands for the International Classification of Diseases, 10th Revision Clinical Modification. It's used to describe why a service was provided, that is, the patient's diagnosis. This system is maintained by the World Health Organization and includes codes for everything from common infections to rare diseases, injuries, and even social determinants of health. ICD10CM is divided into 21 chapters. A few examples most commonly used in radiology: Chapter 2, Neoplasms; Chapter 10, Respiratory Diseases; Chapter 13, Musculoskeletal Disorders; Chapter 18, Abnormal Signs and Symptoms. You'll use ICD10CM codes to explain the medical necessity behind each procedure or service. Section 5. Modifiers and modifier indicators. Modifiers are 2-character codes added to CPT or HCPCS codes to provide more detail, like when a service is only partially done or when it's performed by more than one provider. Let's look at a real-world example from radiology: a single-view chest X-ray, coded as 71045. Scenario: a patient arrives at the hospital emergency room with shortness of breath. The attending physician orders a single-view chest X-ray. The hospital's radiology department performs the exam, and a radiologist interprets the results. In a hospital, the radiologist doesn't own the equipment, so the billing is split: 710045-26 for the radiologist's interpretation, professional component, 71045-TC for the hospital's equipment, tech and imaging, technical component. Each part is billed separately but must be backed up by documentation, like the radiologist's report or the hospital's exam record. Using modifiers correctly ensures both parties get paid and avoids duplicate billing. Radiology modifier example: same-day chest X-rays with repeat, distinct, and professional component modifiers. Let's look at a real-world scenario that shows how multiple modifiers work together when a patient receives more than one X-ray on the same day. Scenario: a patient arrives at the emergency room and is sent to the radiology department for a 2-view chest X-ray. Later that same day, while still in the ER, the patient develops shortness of breath and chest pain. The ER physician orders a portable 1-view chest X-ray at the bedside. The first X-ray, 71046, is interpreted by Dr. Jones, radiologist on duty. The portable X-ray 71045 is interpreted later by Dr. Jones. Since these are two separate services, happening at different times and interpreted by the same physician, multiple modifiers are required to explain the situation clearly. For billing, the second chest X-ray must be reported with the appropriate modifiers: XE to indicate a different encounter with less views than the first chest X-ray, and Modifier 26 for the professional component. Modifier explanation for CPT 7104626 and CPT 714526-XE. Modifier 26 is added to both codes to show the radiologist is only billing for the professional interpretation of the X-ray. Modifier XE indicates the second chest X-ray was done during a separate encounter with less views than the first chest X-ray and a change in the patient's condition. Repeat imaging must be justified by clinical documentation, such as a change in the patient's condition or new orders from the physician. This combination of modifiers tells the full story: 2 separate exams, 2 different times with a medical need for the second chest X-ray, all clearly supported by clinical documentation and correctly billed for reimbursement. Using modifiers like 26 and XE appropriately helps ensure accurate billing and avoids denials based on National Correct Coding Initiative (NCCI) edits. These guidelines reinforce the importance of pairing accurate coding with strong documentation to support the need for repeated imaging services. Great job sticking with it. You've just tackled the core tools of radiology coding. Whether you're learning the ropes or sharpening your skills, this knowledge will carry you far. Thanks for watching this introduction to radiology medical coding. To help you follow along and review what you've learned, I've created a free downloadable PDF with the lesson outline and key notes. Just click the link below this video to access the free PDF now. This resource is perfect for reviewing concepts, taking notes, or studying at your own pace. You can view it on my website or download the entire course PDF, which includes all 5 written lessons, each with detailed outlines and notes that match the video content. Links below. Don't forget to download it, and I'll see you in the next lesson.